and the Medical Officer of Health and CEO of the Middlesex-London Health Unit, Dr. Chris Mackie. As always, we welcome the media who are in attendance today and invite them to submit their questions in the question forum here on Microsoft Teams, and we will get to your questions. Please indicate your media outlet and your name. And to those who are tuning in on Rogers Television, Rogers Facebook page, and the Rogers YouTube channel, we welcome you. And also the listeners who are tuning in on Global News Radio, AM 980 CFPL, and those joining us this afternoon on CTV London's website. We'll get to the opening remarks right away, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. We heard earlier today that Ontario has extended its emergency order to at least June 9th. So what does that mean? It means things like bars and restaurants are going to be remaining closed for at least another 2 weeks and possibly longer. And notwithstanding, you know that restaurants have curbside delivery and pickup. And those are things we certainly encourage people to take advantage of to help support our local area facilities. But the same goes for playground equipment and no gatherings involving groups larger than 5. This provincial order also covers public schools, splash pads, childcare centers, and theaters. Now, I know this is going to come as a disappointment to many, but I'm fully supportive of the Premier's approach on this. We're in the early stages of reopening our economy and reacquainting ourselves with some of the luxuries we perhaps may have taken for granted. But now is not the time to rush things, because the fact is what we're doing and how we're doing it is working. There's been talk recently about allowing for regional reopenings, essentially allowing municipalities like London to reopen at a faster pace than other parts of the province that have been harder hit. Now, I know in some ways that seems to make some sense, but I don't think it's particularly practical. You see, if we reopen certain services in London, suddenly our city becomes the magnet for those who live in harder hit communities as much as a couple of hours away, where those services are not readily available. And we absolutely run the risk of a surge in cases locally. And when I say we're all in this together, that extends beyond just London. We need to know the region itself is healthy and able to contain the spread of this virus before moving out of step with our neighbors to the north, south, east, and west. But we'd like to briefly touch on the issue of long-term care homes. As I indicated yesterday, the report prepared by members of the Canadian Armed Forces detailing some horrific conditions at several long-term care facilities outside of London was truly jarring. Both the Prime Minister and the Premier have indicated a strong commitment to tackling the issue, and London stands ready to assist or cooperate in any way they may deem helpful. Having said that, I want to assure everyone, especially families of loved ones, that in no way are the conditions described by that report reflective of the conditions at our own public Dearness home. At all times, Dearness staff are absolutely committed to providing the highest levels of health care and service possible. And during these times, they've taken all precautions possible to do everything they can to stop the spread of COVID-19. And at this point, there have been no positive cases, either with residents nor with staff. At all times, Dearness takes great pride in an excellent compliance record with the acts and regulations, accreditation, designation, strong infection control measures, outstanding infection control history over many years, and full staffing levels with properly qualified and educated staff. London is a community in which residents can feel safe and cared for, where families can feel secure in the knowledge that their loved ones are being treated with compassion, with dignity, and the attention they so clearly deserve. And finally, a reminder, our cooling centers are still open and will remain open until the heat warning is lifted. And as we speak right now, it is currently on. We have one cooling center at the Canada Games Aquatic Centre on Wonderland Road North and another at the South London Community Centre. They both open until 7 p.m. tonight. In addition, we have a number of community agencies working together to support those accessing the services during the extreme heat. So let me acknowledge YOU at Loza, the Arc, my sister's place, all providing services for up to 5 people at a time, including water and snacks. Our city's coordinated informed response program is also offering refreshments and snacks as needed. And London Cares has increased its outreach presence in the core, offering water to people in the downtown. All ways that are trying to show that we as a community care And I so appreciate our staff and all the agencies for the work they do. And speaking of people for the great work they do, Dr. Mackay.
Thank you very much, Mr. Mayor. So first of all, to the numbers. We had 4 cases of COVID diagnosed yesterday in the London and Middlesex area, 1 death, an elderly woman in a long-term care home. Provincially, we had another good day, only 297 cases. That's only the 3rd time in the last 2 months where we've seen less than 300 cases. We know those cases do jump around depending on how the lab is able to process tests. So we're not going to hang our hats on this really defining a new trend for the province, but it certainly is reassuring. And also in the context of dramatically increased tests that were processed yesterday as well, 15,000 versus about 9,000 the previous day. So that's all great news. There's been lots of discussion about whether we should be taking a regional approach with opening up businesses and the rest of society in response to the waning pandemic. I think the mayor's comments are really important. More so than anywhere else in Canada, the corridor from Windsor to at least Kingston, if not Ottawa, is highly integrated in terms of how we live, work, and play. And so what is happening in one part of that corridor will affect the other parts. And so we happen to be in a good position right now in the London and Middlesex, where our numbers are relatively low compared to most of the areas around us. But we do not want to put that in jeopardy by opening up additional facilities and potentially tipping the balance of the pandemic here towards the increasing cases, as you've seen in the GTA. There's also been lots of discussion about the document that a group of medical officers of health has put together that describes indicators for when different parts of the province could potentially open up. On the one hand, the question of having it always an important question for informing public health measures. On the other hand, we're very early in terms of knowing how that data is really going to be able to show variability across the province. And there are lots of strategic considerations about whether we do see variation and whether we should be acting on that in terms of different approaches in different parts of the province. So I'm going to pause there. Dan, happy to take any questions.
All right. Thank you, Dr. Mackay, and thank you, Mayor Holder. Actually, Dr. Mackay, a couple of the questions do have to do with that very topic and the regional way of looking at the coronavirus. So why don't we get to those questions specifically? The first is from Sophia Rodriguez at CBC London. And this actually, both of you can speak to this. We'll start with you, Dr. Mackay. Considering more than 70% of recent COVID-19 cases are in the GTA, do you think restrictions should be more relaxed in areas that haven't been as hard hit, including London?
Yeah, so I think both the mayor and I have made some comments. I mean, it's really about, do you want those areas to become hard hit? We're on the fence right now. The reproductive number, which is how we measure whether an outbreak is propagated or not, is right around 1. When it's above 1, you're seeing a pandemic grow. When it's below 1, you're seeing a pandemic fade away, and we're right on the bubble. And so further openings at this stage could put us in a position where we're starting to see the pandemic wave come right back in this area.
Mayor Holder?
Thank you. I absolutely look forward to the time that we have regional reopenings. I think Dr. Mackay and I are of one mind that way, but now is not that time. We've worked too hard as a community to have things go absolutely in inverse proportion to the numbers that are in place now. We've worked hard. I mean, time after time, we've encouraged the London community, the Middlesex community to practice self-distancing, even when weather's been great. We've asked them to be mindful of putting crowds together not greater than 5, and again, still with safe distancing, to do the hygiene things. I mean, we've stressed that, Dr. Mackay, for weeks and months, haven't we? And we've just been so at a point where our numbers have been consistently good. And there are some other areas in this province that are more challenged. And it really is true that if we opened up our community, even for our own folks, it does become that magnet. And for other communities that may not have been as fortunate. And no fault of many of the individuals who may in fact be impacted quite directly. But no, now is not that time. When the provincial numbers become more consistently positive, as Dr. Mackay suggested earlier, I'm quite comfortable with having those discussions again with the Medical Officer of Health and with the Premier. But at this point, now is not the time.
All right, thank you both. The next question is from Casey Taylor at Easy 101 Country 107. And gentlemen, again, the question is on the same topic, but I think the specific questions may be a little different and something we haven't talked about yet. So the question is for Dr. Mackay. The Globe and Mail has a story suggesting some regional medical officers of health are looking for a more regional approach, essentially asking for harder hit areas to be able to delay reopening even if the province decides to move forward into phase 2. Is this something you're in favor of? If Toronto sees another spike, do you think it should take a step back while London and Middlesex, just 2 hours down the 401, continue to reopen?
Yeah, the reality of being in local public health is that, we really do focus on what is happening here. We have awareness of what is happening around us, but it's not a situation where really I could prescribe, what would be appropriate for Toronto to handle the pandemic wave that's going through there. It's a different community, different assets, different demographics, different population densities. And so that's why we would rely on, the expert public health people who live and work there to be guiding public health decisions in the area. The reality is that right now, medical officers of health do have the authority under legislation to take additional actions if they need to. So, whether that is related to provincial decisions or outside of provincial decisions, the medical officers of health under the Health Protection and Promotion Act have that authority. That's authority that the provincial government has ceded to medical officers of health to take steps to protect their populations when needed. And you've seen that happen in several places across this province during the pandemic so far.
All right, thank you very much for that pretty comprehensive answer, Dr. Mackay and Mayor Holder. Gentlemen, we are out of questions already today on our virtual media briefing, so I think this may be a record actually in terms of the short one. Perhaps folks are just hoping to get outside and enjoy some more of that nice weather before the clouds and the showers and the cooler temperatures come in. So I want to thank you for your time and thank those who've tuned in. And we will see you again tomorrow at 2 o'clock for our next virtual media briefing. Have a great rest of the day.